Now, 70% of elderly Singaporeans say one of the most important aspects of aging successfully is being cared for by their children, and at the same time, being self-sufficient and having a social life are also key.
The findings are from a 3-year survey of more than 1,500 people and is done by the National University of Singapore to help relevant organisations plan programs for the elderly. Vimita Mohandas has more.
From 2012 onwards, over 900,000 baby boomers in Singapore will hit the retirement age. This means that more than a quarter of the citizen population is reaching or has already reached retirement age. In light of this, Chairman for the Council of Third Age, Gerard E, said Singaporeans have to change the unhealthy perspective towards aging. He added that findings from this survey will help society better understand how to provide more support for the elderly. One key area being studied is what is preventing elderly Singaporeans from going for health screenings. The study showed that more than a quarter of the respondents said one barrier that prevents them from going for a health checkup is finding the time to do so. And almost half of them believe that life and death are all predestined, and there's nothing that can be done to change their destiny. The survey found that those who isolate themselves from society are more likely to be women, and they are also less likely to undergo health screenings. But in general, the report said take-up rates of health screening tests among Singaporeans are considered to be relatively reasonable. Researchers added that stronger social support within the community is also crucial.
Being connected means that it's not just having one physician to 100 people in the population, but rather having sustained kind of staying power, right, where you start to grow relationships, and that can be manipulated in a certain way in the way we organize healthcare delivery, right? So not necessarily always asking for more resources, but really just thinking of a better way in which these resources could be delivered.
A similar survey also took place in Seoul and Shanghai. It found that more people in Seoul went for diabetes, cholesterol and colon cancer screening compared to those in Singapore and Shanghai. The survey also showed that respondents in Singapore were satisfied with their lives compared to those in the other two cities.